We are continuing our discussion on the coronavirus or COVID-19 pandemic. And with new case numbers increasing again throughout the country and here in Florida, due mostly to the Delta variant, many residents are questioning what we should do next. Orange County government is suggesting that all residents wear face masks again while indoors. So what does that mean for all of us? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from our state medical professionals, and joining us is Alvina, epidemiologist with the Florida Department of Health in Orange County. Alvina, thank you for being with us today.
Thank you so much for having me again.
So, Alvina, where are we in both the state and the county as it relates to how we're doing when it comes to fighting the coronavirus pandemic?
Well, as you know, we continue to offer vaccinations and we continue our COVID-19 response efforts, which includes the contact tracing. Unfortunately, we have seen most recently over the last several weeks a sharp increase in the number of new infections within our county in Central Florida and also in many parts of the United States. And these infections, we'll mention, are primarily in unvaccinated persons.
Now, Orange County Mayor Demings has suggested that all residents wear a mask indoors. Why the shift?
Well, one is we've seen an increase in the percent positivity. The 14-day rolling average has been creeping up, and also we have this sharp increase in new cases. Previously, I believe in the last couple of weeks when we've spoken, we were at what's called a moderate or low level of community transmission, and within the last week or two, Orange County has now been classified as high risk for community transmission. And so with this change and this increase, we know that there are more infections happening within our community. And so the recommendation is to wear a mask while you're indoors in a crowded situation where there are a lot of people, and potentially a lot of people who you don't know whether they're vaccinated or not. And so with the sort of relaxation or the decrease of physical distancing that's been happening, and also the optional or the recommendation that people who are unvaccinated wear masks, and you not knowing whether or not that's true, it's recommended that if you're in a crowded situation with a lot of people that you wear a mask while indoors.
Tell us about the Delta variant and what it's, is it more contagious? Is it more severe?
So the Delta variant is one of the COVID-19 virus variants of concern. It has been shown to be much more transmissible than the B.1.1.7 or the Alpha variant, which we thought already was easily transmissible. And it's been shown to be about 225% more transmissible than the wild type or the original strain. And so we know that this virus can easily affect many more people than before. We don't yet know. Early studies are showing that it's not necessarily more severe, but with the increased rates of transmission, it means an increased number of infections and thus potentially an increased number of hospitalizations and potentially deaths.
Are we seeing a lot more cases of the Delta variant here in Florida?
And so as part of our genomic surveillance in tracking the variants that are here in Central Florida, we look at, say, the proportion of those variants that are identified. So since not every virus that's identified or not every infection gets, say, genomic surveillance, we look to see whether or not the proportion is changing for those variants that do get sequenced. We focused on looking at or identifying sequences or viruses that might have severe health outcomes, such as hospitalizations or deaths. And so that sampling is a little bit biased. And so just going by straight numbers, it's hard to say. But we have, over the last, say, 3 or 4 weeks or 3 or 4 periods, seen a doubling of the proportion of the Delta variants identified in all those variants seen in Orange County, which means that currently the Delta variant makes up about 60% of the variants that we identify. In the 2 weeks prior to that, it was 30%. In the 2 weeks prior to that, it was 15%. And then 2 weeks prior to that, it was 0. And so The current CDC estimates, which are reflected here in our data in Orange County, is that the Delta variant will become, if it is not already, the dominant circulating strain within the United States.
Wow. And what's happening with the efforts to get children ages 12 to 17 vaccinated as we prepare for this upcoming school year?
We're really working closely with our Orange County Public Schools to increase vaccinations in school-age children. And so currently there are some vaccine events that are happening in middle schools and high schools just before the opening of school, so that we can try to encourage that increased community immunity once children go back to school in August.
And as an epidemiologist, what would your recommendations be for us just behaviorally, whether you're vaccinated or not? What should we be doing to keep ourselves safe?
And really, it's to be mindful of the pandemic precautions when you're in those higher risk scenarios, such as if you're in a place where there's a lot of unmasked people who are very close together, so, kind of like the opposite of the pandemic precautions. That's where you would want to be aware. And if you're a vaccinated person, it's if you're vaccinated but have some immunosuppressed condition, or if you might be older, if you think you might not have a robust immune response, you could take that extra layer of protection of wearing a mask and maintaining your social distancing to give yourself extra assurance to prevent transmission.
Alvina Chu, thank you very much for being with us today and keeping us informed from the front lines as usual. It's always a pleasure to be with you.
Thank you.
And of course, we'll be right back with more. Stay with us. The COVID-19 pandemic has been part of our daily lives for almost a year and a half. Here in Central Florida, we faced multiple surges in COVID positive cases, and with the number of positive cases on the rise again, more Central Floridians are experiencing pandemic exhaustion and mental health challenges. And with us now is Dr. Tracy Wharton with the UCF School of Social Work to explain how we can fight this feeling of pandemic fatigue. Dr. Wharton, thank you for being with us today.
Thank you for having me.
You know, Dr. Wharton, a lot of people in this rise of COVID positive cases are starting to feel pandemic fatigue, COVID-19 fatigue. Is that something that was expected once we started down this road?
I don't think we expected it. We're sort of hardwired to respond to emergencies with lots of adrenaline. And once we were able to understand there's risk, right? Because it's not something we can point to. It's a sort of invisible risk. And once we spent a lot of time helping people understand what that risk was. And then we were all sort of staying home, and we all sort of thought, oh, we can do this. Originally, remember, we thought it would be 2 weeks. Right. We can do that, right? I got this, 2 weeks. And then as time went on, learning to adapt, and all of a sudden everything is in the same place, and this sort of nebulous fear. So I don't think that people really expected to sort of hit a wall, but I also don't think it's unusual either when you sort of think about how long this has gone on in this sort of minor state of emergency. Yeah, it's pretty normal to feel what we're now calling pandemic fatigue. I think we're all there.
And and one of the things that a lot of people, the worst thing is that you don't know that you're having pandemic fatigue because you're dealing with it. What are some of the symptoms that people can look for in themselves and others that really show that they are experiencing this fatigue?
I think you're right. You sort of get in this mindset of, I got this, I'm just going to keep my head down, I'm going to keep going. And we made a lot of compromises that were meant to be temporary, right? So especially if you are parenting, if you've got kids who have been going to school, now of course it's summer, so everybody's home. If you are caring for another adult at home, you have aging parents, all of a sudden, prior, in the before times, many of us had this sort of commute to work. You get up, you do your thing, you go out the door, and you've got your transitional period to work. And then you have this transitional period, even if you just, your office is next door, of coming home. And we lost all of that. And so everything is in the same place. And so one of the things that happened is boundaries started to get really fuzzy, right? What's work? What's home? And even so, I'm sitting. This is my home office, and my living room is about 5 steps over that way. And what you can't see is the pile of books and my treadmill and stuff. All these boundaries get really fuzzy, and so some of these symptoms that people started experiencing were this sort of um, loss of what's here and what's there, right? So, I'll just sit down and do that little bit of work this evening and I'll just keep working because I have that extra time now, right? I don't have to commute. Or, in the middle of the day, I'm just exhausted. You know what? I'm just going to watch TV for a little while and not. And so the boundaries get really fuzzy and it does kind of wear on you after a while because it's hard to kind of know, it's hard to keep these things straight. Lots of people are saying, anxiety, this sort of generalized, kind of nebulous, it's out there feeling of uneasiness, discomfort. Because, and again, it's this whole thing of there is a risk out there. It's very hard to point to. The rules keep changing. We thought we would have this, we're going to get vaccinated and then it'll all go back to normal. That's not what happened. So, a lot of people are saying they're feeling this sort of general uneasiness, feeling kind of tired and apathetic. There was a great article in the New York Times that came out. I've lost a little bit of track of time. That's another thing, probably, right? Time anchors. Like, what day is it? A while ago, there was this New York Times article that talked about languishing. And I love that word because it really resonated for a lot of people that we're not really, it's not that you're bored. It's not that you're depressed. It's just we're kind of like, that feeling of waiting for the other shoe to drop. You're just kind of languishing. We're just kind of waiting. And I think that resonated for a lot of people. I think that's sort of what's happening for many, many people. And it's not, you're not crazy. You're not imagining it. It really is there.
So what would you recommend for us to do to try to make our way through this, to deal with that exhaustion and all of its symptoms?
I think there are a number of things. I think it's really easy for us to say, gosh, take care of yourself. Self-care has become kind of this buzzword. And so I want to be real careful as I say this to let's not blame the victim here, right? The reason people are feeling like this is not their fault. It's not that anybody stopped exercising or stopped going out with friends. We all did. And in this context is taking care of yourself has been difficult. It's one more thing on the list, right? I put it on my list. I got to go for a walk every day. And then it becomes one more thing. So I just want to put that out there that it's hard when we say like, listen, all these people baking bread, I wish that could be me. I'm a terrible baker anyway, but I just, somehow there wasn't time and I was busy, so there are a number of things that you can do. I think, we do what we can, and you have to sort of bear in mind, you do what you can and you keep trying. So you want to keep things like sleep, exercise, nutrition, like what am I eating? Am I eating? Gosh, did I forget to eat lunch today? What am I eating? How much am I snacking? Are these good things for me? Exercise and getting some sunlight, keep those on your radar screen. I don't want to say like you must take a walk every day. That would be great. But sometimes what you can do is like, what I do is when I go out to get my mail, I walk around the block. I have a small block. So it's 10 minutes, it's out, I'm getting a little bit of sunlight, I'm moving my body, I'm taking a breath in the air outside, I'm changing my environment, and I'm switching gears for just a few moments, giving my brain a chance to think of something else besides focusing on the screen. So switching things up a little bit. I don't mean being, hyper multitasking, but I mean sometimes sort of work on one thing for a while and then work on something else, especially if you sit at a computer screen for most of the day, or you're doing the same thing, or you're moving between your kids and, switching things up. You can even do that on your calendar and sort of block out what you need to do during the week. Give yourself a time, like schedule with yourself. I'm going to work on this thing at this time. And then that sort of gives you a little bit more control over your schedule. One of the things that's kind of happened is when you move everything into the same space, you kind of lose those boundaries. And so I think one of the things people can do is begin to put some of those boundaries back. And by that, I mean sort of saying, you know what, I'm done with work for today. I'm going to close the computer. I'm going to not sit at my desk. I'm going to do something else. Saying it's time for me to go to sleep. I'm not going to check my email one more time before I go to bed. Now, so I know many people have gotten in the habit of doing things like respond anytime you get an email after 6 o'clock. I don't know how many people are like me and they compulsively check the email just to see if there's the one more thing. To be able to say, I see your email. I just want you to know I see your email. I'm not working right now. I'll get back to you tomorrow. So that you're saying, like, I see you. I'm not ignoring you. I've sent messages to my students sometimes in the evenings at 6 or 7 o'clock, like, I'm not ignoring you. I promise. I see you. I'll just email you tomorrow when I'm working. Just because many of us do work at night doesn't mean everybody else has to as well. So setting some of those boundaries for yourself and not feeling bad about it.
That's really great advice. Thank you. And one of the things that we're also dealing with is there are so many things that are changing because of the vaccinations, because of the rise in cases, all kinds of things that are happening. And there's also a lot of misinformation. How does that misinformation, the proliferation of misinformation, also add another layer onto that stress?
Yeah, that's so true. It does for those. Well, so they're actually sort of, if you think of it like two groups of people, and I want to address both very quickly because I know we have a really diverse audience of many people with many different sources of information. And for people who don't see a threat or don't understand the threat, because remember, it is something of an abstract, right? And there is a lot of bad information out there. And somehow a lot of the science has become politicized. And so some of this gets into this aspect of, oh, if you wear a mask, you're a Democrat, if you get a vaccine, somehow some of this became politicized, and it does play into those decisions. And that makes it very difficult for people to get good information and make a reasonable decision for themselves. But for those people who don't see a threat, they're experiencing a world where people are being reactive to something that they don't see. And that's exhausting, right? So it's sort of like swimming offshore and everybody's yelling at you and going, don't you see the shark? And you're like, I don't know, the waves are great. I don't see a shark. Right. And so that's kind of exhausting to navigate that world. For those of us who do understand the threat, I say those of us because I happen to be in that camp. I guess I just, out of my own beliefs, but for people who do see the threat and are responding to that, it's really hard to see people or hear people discount or dismiss things, especially when it's somebody that you care about. So seeing a risk to other people that you care about and watching them not take it seriously is very tiring. And it can also create a lot of anxiety and fear depending on who it is. So, if your parents are not taking it seriously, the fear that kind of naturally happens of attributing that is something that's hard to deal with. In a place where there are a lot of choices to be made, there is a lot of science to understand, and vaccines are not, it's not a straightforward science, right? So there's some hardcore science, and how that gets put out in the public and how we talk about those things has been a little bit complicated over the last year. And so we're talking about a long period of time of paying attention to something that's pretty complicated. And very abstract. And so that's been difficult to try and make sure that people have good information to make that decision, make all the decisions.
So, Dr. Wharton, exists the potential that we will have to live with this pandemic, with this outbreak for the next year, let's say. Mm-hmm. What advice would you have for just pacing ourselves and girding our loins for this to go into 2022, and we'll have to deal with this, and in what for really ultimately may be a lifestyle change for pretty much everybody? What advice would you have for the long haul?
Yeah, so many emotional reactions to that too, because of course this is all of us, right? That's a really great way of putting it, is that maybe we're looking at a lifestyle change. Honestly, I don't think any of us really thought about how many germs are on everything that we touch until this happened. And I don't know that we can go back to not thinking about that when you touch the handle on the door of how many germs there are. So yes, there's probably some lifestyle change. We don't know how long this is going to go on, and so there are some things. I think there are a couple of things that people can do. One is that, really try to make sure that you're getting good information. Ask questions. If you ask questions about the vaccines, ask questions about masks, and there's nothing wrong with asking questions. And if you don't know the answer to something and someone's asking, help them find neutral sources of information and get that out there. Like I said, keep some sleep, nutrition, exercise, and getting some fresh air and sunlight on your radar screen. Set some boundaries. Don't feel bad about it. Do what you can and be okay with that. It is okay to not be okay. For many people, connection to their faith community is really important. As things have shut down and then started opening and then shut down again and then started opening, a lot of people have kind of lost that deep connection to being in person with their faith community. So, if you're able to reconnect to members of your faith community, those are really important connections. They give us a social connection, they give us a sense of belonging, and faith is a very great strength, regardless of what your faith is. So
Absolutely.
there are lots of ways to connect with people who are friends, who are family, who are members of your faith community. Those things are really important.
Absolutely.
And I guess the other thing I really want people to know is it is okay to not be okay. If you find, however, that you are struggling and you cannot focus and you really are unable to function and you're really struggling, talk to somebody. You can talk to a pastor or a minister. You can talk to some friends. There are a lot of professionals and a lot of ways to connect with professionals. If you have an EAP program through your work, this is a great time. And I don't know if people realize this, but EAP, you're not talking to somebody that you work with. They make referrals. So my private practice, for example, we take contracts from EAP, and it's not people that I work with at my university. So they refer out to another therapist, and they will pay for therapy through those EAP programs. Different companies have different arrangements, but it's a great time to use those benefits, just to have some safe space to unpack that stuff and use your insurance benefits. There are lots of ways that you can connect, even online chat. There's now some, Talkspace has a thing where you can chat with people or text or videos on your phone. Lots of ways in person or using technology to talk to somebody, but please don't feel bad about doing that. It's a lot easier than it has been before, and if you are struggling, it's time to reach out and get some support.
Absolutely. Well, Dr. Wharton, thank you so much. It's been very valuable information, so we really appreciate you being with us today. Thanks a lot.
My pleasure. Thank you so much.
And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve this community. And of course, we are also here to help you keep making those healthy connections. Stay safe.